Okay, so I'm going to start with a few house rules while we are at it. I'm going to give the house rules before I give an introduction of our presenters for the evening. Please refrain from using the raised hand button, but type your comments and questions in the Q&A tab, which will be addressed at the end of the session. If it's a question that is directed or related to SADA, then it will be responded to you online. The CPD certificates will be loaded onto the SADA website, and you will be able to access all your certificates under your membership profile. If you are not a SADA member, you will be able to create a profile for yourself and access your CPD certificates. The event tonight qualifies for 1 CEU. Please note that we are streaming live on YouTube, just in case you are struggling to gain access to the Zoom platform. Please just notify your friends or your colleagues that want to join the session, that are struggling to get through to Zoom. We are streaming live on YouTube. And this is just a reminder that at the end of the session, there will be a questionnaire or an evaluation form that will come through. Please remember to fill in that evaluation form. It does assist us with the different webinars that we present to you. Our upcoming events, we just want to remind everyone about the exciting SADA Congress that we have from the 27th to the 29th of August. It's an exciting one because it's our first ever virtual event. So we are encouraging all our members, and when I say members, I'm encouraging all members of the oral health fraternity to please register, go on our website, and it will allow you'll go through the process of registering for the Congress. Our next webinar will be on the 8th of July, and it will be for the dental therapy, the dental therapists. And then after that, on the 14th of July, we will have a Henry Schein presentation. So at that, I'm going to introduce our speakers for the evening and hand over to the ladies so that they can give you the beautiful presentation that they have for tonight. I'm so excited myself. So tonight we have Dr. Janel Welgemoed, who qualified with a degree in dentistry in 1991 and a business administration degree in 1998. Both of them, she attained them from the University of Stellenbosch. She has been in full-time private practice for 30 years. Apart from working full-time in dentistry, she also manages a team of 14 people in 2 practices located in Noordhoek and Simonstown, both in the Western Cape. Dr. Welgemoed is a member of SADA, a member of the international team of implantology, the South African Association for Osseointegration, the Periodontic Society of South Africa. She's also a board member of the South African Academy of Aesthetic Dentistry. Dr. Welgemoed has a great passion for dentistry and understands that no dental practice can be successful without good organizational and management skills. Our next speaker, who will speak together with Dr. Welgemoed, is no stranger to our screens. In fact, if you have visited our website with all the videos that we've made to encourage members about the upcoming Congress, you may have seen her during a recording, and that is Miss Melanie Savidas. She started her dental career as a dental assistant in 1983. She met Joyce Rapiri, who was involved with the Dental Association and soon got involved in the group. She then joined the Dental Warehouse in 1990, where she worked as a dental representative and later became a joint MD. In 2018, she started her own company, Incisal Edge, and remains passionate about developing dental assistants and the dental team. Welcome, ladies, and thank you very much. I don't want to waste any time, so with that, I'm going to hand over to you. Thank you very much.
Thank you, Dr.
Right. Thank you, Dr. Metsing, for the kind introduction, and thank you, Melanie, for joining me tonight to present this webinar. Tonight, the stars of the show is the dental assistants, and we've chosen the title for it, like Howard Ferran says, because all dentists need heroes too. Now, I think I'm going to represent probably more the dentist, and Melanie's going to talk a little bit from the dental assistant's point of view, because we come from different angles. But like I said, welcome, a special welcome to the dental assistants listening tonight. And I hope, or we hope, that you're going to, there we are, that's better. We hope that you're going to get some tips and tools tonight that you can go in tomorrow with renewed energy and renewed passion for your job, because dentistry is a passionate industry and it's something that we all love and we all can try to get better at it. Melanie.
Hello, and it's lovely to be able to speak with you tonight. It is quite interesting. We've never really met face to face, and we've heard of each other and we've got to know each other along the last week, I'd say. And so we can speak as friends to dental assistants, and hopefully I know a lot of my friends who are dentists are listening tonight. And I was going to give shout outs, and I don't know if that's allowed, but anyway, I said I'll have to shout out to all of them. But there's a whole list of them out there who know me very well. And it's a privilege to speak to you, Janel, with you on this platform tonight. And the discussion ranged really with the two of us. And we had lovely debate on roles and how all of us should be working as teams. And it was really good to understand your side of things when you actually work with 14 team members. So you have a lot of experience, and I think we're all going to learn a lot tonight. So when Doctor says that, it's not just suctioning with dental assistants, she means that, because I know for a fact her dental assistant has been with her for a record number of years. How long has she been with you?
Well, Monica, that's working currently for me, has been in my practice for 18 years. And before that, I worked with Terry for 10 years, who's now in New Zealand. And before that, with Liesel for about 10 years. And now she's my receptionist. So she's been in the practice for many, many years. Yeah. Now I love
yeah. Amazing.
But like you said, when I started practicing 30 years ago, dental assistants didn't need formal training. You could take someone off the street, train them in-house, but that has changed. And it's a feather in the cap of the dental assistant, because the Health Professional Council of South Africa has recognized the dental assistant as an integral part of the oral healthcare team. And for that reason, they now need to be formally trained. They also need to keep up to date with the industry and with their knowledge. So they need to adhere to CPD requirements. And I must be honest, and that's how I experience dentistry. When I do dentistry, I create smiles with my dentist, for my patients. I relieve pain, and I struggle through an extraction and through a difficult root canal treatment with my dental assistant right next to me. She goes through everything that I experience with me. I can't do without her, she can't do without me, and the patient definitely can't do without either of us. So, Melanie,
you probably find that the two of you, when you leave the room, she can talk to the patient about various things. And, they become so used to you as a team that if you ever leave each other, they really have to adapt to a new person. And so it's such an integral relationship. It's almost like juggling. You drop the ball and things don't work. So I think in terms of the infection control range today, it's an absolute necessity for the team to sit together and to discuss what the new protocols are. We'll talk about more infection control later, but in general, to discuss how can we make people feel safe when they come, and how do we feel safe at work as well when we get to work? How do we travel to work? All these areas are important for us to keep the infection control chain going, because if we come to work and we haven't worn a mask on our taxi or on the way to work, we socialize with people, this is breaking that chain again. So we have to adhere to the protocols of practices to keep everyone safe. And this is the role of the dental assistant. One of the most important parts of her role is to practice the infection control routine. And we'll go through other areas as well.
Yeah, and that has not changed a lot with the COVID pandemic as well. And then I've also mentioned that there's other roles or functions that the dental assistant has to fulfill, like even instrument and equipment maintenance. But before we get to that, there's a little tick list that I just want to make sure that all our dental assistants, I've jumped the gun out a little bit. First, let's have a look at the characteristics of a Euro dental assistant. And I've just mentioned a few. There are many, many, many more. So, Melanie, you also, when we had discussions, we're talking a lot about the team playing and the relationships, and communication was a big one for you.
I think so. I mean, if you cannot communicate in a practice, there is just no way you're going to be successful. And the communication is not just good morning, doctor. There are so many ways of communicating. It's the way you look at each other, the way you take an instrument from each other. You know, when you feel moody, you know, it's not that day for you. The way you snap at each other. Do you really think that people don't notice? So the communication is good and bad, but you only can have good communication if you strive towards talking to each other, talking to the dentist about what's happening, what are the roles, what are expected from us, what should we be doing next, how do we conquer this together? So I think, and you have to talk about what your preparation is, and we'll talk about that a little later. But when you talk about the skills of dental assistants, you also need to have so much more. You know, when a dentist comes in and you can see they're having a hard day, they're having the most awful root canal treatment. You cannot find that last canal. You know, you can say, doctor, don't you think you would like a little cup of tea? Be a human being as well and offer some, you know, delightful things during that day. You know, we always want to have some way of making each other feel part of the team and knowing you recognize each other. That goes for both of you. There's only been one case where I actually really needed a cup of tea from a dentist. You know, we had a very difficult case one day, and I needed that cup of tea. Because it was very gory surgery and I hadn't seen all these things before when I was just starting in dentistry. So I thought I was going to pass out at one point. So yeah, it's not always easy. But with communication, we can say exactly how we feel to each other without having to be angry at each other. This idea of sulking and I don't talk to you for the rest of the day is really not conducive to work.
But look at all the characteristics that we expect of a Euro dental assistant. And that's the reason why I say assistants are heroes in the dental room. You need to be helpful. You need to be a people's person because you have to understand your dentist. You have to communicate with the dentist. But then every half an hour, every hour, a different patient comes in. You need to be able to read the patient, read the situation. That's why we say you need to be an excellent communicator. You need to be the ultimate team player because you're in a little team in the room, but then you're in a bigger team within the bigger practice. You need to be a multitasker. I mean, there is almost no person in the practice that has to be more of a multitasker than the dental assistant. We expect you to have empathy, to be passionate, to be patient with both the dentist and the patient. You need to be super organized, a specialist in infection control, and they know everything about dental materials. An absolute hero in the room. Before we get to all the tools and tricks, we're going to show you tonight. I'm also going to tell you the reason why we feel that you need to be the hero. So tonight we're going to give you tips and tools of how to take charge of your position as dental assistant and how you can increase the value in your practice, mainly in looking at two aspects of your job. The one is how you interact with other people and role players within the dental team. And we're going to show that to you later. And the second one, which comes right at the end of the lecture, is how to organize your job and the different aspects of your job in a more coherent, more reliable way, that you know exactly how to do things, that other people know how you do things, and how you can then have a much calmer way of working. Now, working in this way, by managing your relationships and also being more organized, creates a win-win situation for all. Because, first of all, you're going to enjoy what you do every day a lot more. You will have more job satisfaction, and having more job satisfaction with and enjoying what you're doing is going to create that you and the dentist in the room have higher productivity. So in other words, you can work at a much better pace, do better type of work, better quality work, because you and your team play within the room are at a higher level of service rendering. With higher productivity comes higher profitability. So, and that creates a stronger organization, and a stronger organization gives you job security. And that in today's world is unbelievably important. So within this lecture, we're going to show you exactly how you can be in that position to better yourself.
And in terms of that job security, a lot of the time people feel like this is not the end of the road. It's not the most important job. But when you're a part of a team, there are so many facets that make you learn so many aspects of dental assisting. It's not just assisting in the role of you're just doing fillings, or you're doing composite work, or you're doing endo. You get to do everything, which you become an expert at what to do in a surgical extraction, etc. It's hugely important to learn every aspect and to have that security.
Right. Before we go further, we want to make sure that dental assistants realize that the next needs to be in place. Within your job, you need to have a signed work contract. So that is extremely important. It's required by law from us. Then, obviously, we all need to be registered with the Health Professional Council, and you need to be CPD compliant, which means that you make sure that you've got the requirements that's needed of you every year. And there are many platforms, and Melanie can maybe talk about that, of where you can get your CPD points, of which tonight is one of them. Then the last point that I want to elaborate a little bit on is the job description. And I haven't for nothing said detailed, a detailed job description. So that is an incredibly important document. If that is not in place, then I want to challenge all dental assistants to, within take the next 2 to 3 weeks and create your own job description. So what the job description is that you go and write down all the jobs and all the functions that you play within the dental practice. And after tonight, you will see that some of those functions will get more, and you will have extended functions, because we're going to empower you now tonight to do more things within the practice, so that you can strengthen your position, enjoy your job more. Remember what we said just now. So the job description is, apart from that, you're going to write down what you do on a daily basis and what is expected of you. The other function of the job description is that there's no unclarity or illusion about what you're supposed to do. So often people find themselves that the dentist will say, but you know, it's your job. No, but I didn't know it's my job. I thought it was this one's job. And the job description makes sure that that doesn't happen. You can take the job description to your employer and share it with him or her, and then one will clearly see whether you are on the same page. That the dentist might say, no, you know, actually, I thought that you're doing this and this and this. So please, I want all of you to take on the challenge, go and write it out, take it to the dentist that you work with, and then edit it accordingly. Melanie?
Now, thanks for that. However, I want to reiterate, I got a kitten here, by the way. But what I want to reiterate on was, in a practice, you know, when you're talking about a larger practice as your own practice, a big practice, it becomes easier to have a role, a job description. But a smaller practice, it really must be known that if the receptionist is not at work that day, it becomes your role to fill in those gaps. If you have somebody who does your autoclaving or your infection control sterilization, you need to understand if that person's not there, then you are fitting in that role. So a dental assistant is one who has many arms, and your role is encompassing everything. And I think the more we begin to accept that we are an integral part and we want to do everything, there is obviously a limit to your expertise and time, but you need to fill in. And I encourage ladies to learn as much as they can. Take everything in and become the expert in your practice.
Okay, so without further ado, here we go. So here we've put the dental assistant in the center of the dental healthcare team. And around you, you can see all the role players that you interact with on a daily basis. The dentist, the patient, receptionist, oral hygienist, and then a treatment coordinator, which I will explain a little bit later. That is often the dental assistant as well, or it can be a shared responsibility between the dental assistant and the receptionist. And then the sterilization and maintenance coordinator, which is also often the dental assistant, and in bigger practices, there might be a dedicated person for it. So what we're going to try to achieve tonight is that we're going to look at each and every relationship of the dental assistant with these other role players and see how you interact, how you can interact or change the relationship to strengthen your position. So we mustn't take the ball off or the focus off the ball. So the first relationship that we're going to discuss is the dental assistant-dentist relationship. That is most probably the most important working relationship. You are sharing a small confined area and you spend a lot of time together. It is incredibly important that you respect the position of the dentist and vice versa. You need to be committed and dedicated to this working relationship. So this is your partner in working with, that you're going to achieve do clinical work together, and that's why commitment is required. I often say to my assistant, I see more of her than what I see of anyone else in my life during the working weeks. It is also very critical that you have avenues and ways to handle conflict effectively. It's a close relationship, working relationship, and from time to time, we all know you start get scratchy, you get a little bit annoyed, you feel the other one is not carrying his or her part, and when that happens, you need to have ways and need to talk it out quickly before it becomes a problem or the patient starts noticing it. It helps a lot if you care and like each other. And in any relationship, find the good things, find ways, look at your dentist differently and see, what do I like about him or her? Keep each other positive and motivated. It's often difficult. I mean, dentistry is a difficult job and we have to have the right attitude. Be understanding and patient, like I said before, both with the dentist and with the patient. Value each other, be kind to each other, be loyal, and then be professional. And there I want to also, Melanie can give her point of view, but professional is almost the most important for me of this slide. So like I said earlier, we are now registered with the Health Professional Council, which means that dental assistants are professional healthcare workers. Being professional for me as a dentist means that when we enter the room, we're a professional and we leave our private life behind, we leave our personal opinions and our personal attitudes behind, and we come in and it's consistently the same and ready to do the job well. Melanie.
That's so true. I think professionalism is also the way we look. The role we play has also got to do with how we look when we come to work. Do we wear a uniform? Do we have our names on that uniform? Do we have the practice? Are we proud to be part of our practice that we work at? And that's a professional, where you come to work with a uniform, where you look at yourself every day and you take care of your If your hair is hanging around in your face, remove it or wear a cap or whatever you need to do. But professionalism starts with the first appearance that you have, your nails, the way that your teeth look. Luckily, we have masks that we wear, so we don't always show how our teeth look. So it does make a difference when you're a professional dental assistant that you take care of your teeth, you take care of your health, and you make sure that you use a professional tone with your dentist, with your receptionist, and with your oral hygienist, that you're part of this team and you know that you're professional. You recommend people to see your dentist. You need to know that you can sit in that chair and be proud to sit with that dentist and take treatment or have treatment with your dentist. You're so confident. A professional walks around telling people, this is my dentist. This is who she is or he is. This is the person I work for. They are the best. And I've seen that so many times where you can get patients just by the person walking down the street, the way you look.
Now, the dental assistant and the patient. The dental assistant can elevate the experience of the patient to the next level by giving attention to detail. And there is no other job that requires attention to detail than dentistry. By being professional, you will instill confidence in the patient's mind of your ability to do your job. And here are a few nice, just practical tips that I can share with you. I send my receptionist, my dental assistant out to the reception area to receive the patient and to bring the patient to the room. I know it happens differently in different practices. So my assistant goes out and she meets and greets the patient friendly. If she doesn't know the patient, that it's a new patient to the practice, she will introduce herself to the patient. And when she comes into the room, she will introduce the patient to me. She makes sure that the patient is hand sanitized and that she followed all the COVID protocols. The receptionist is also co-responsible for that duty. And then she explains in a very short way to the patient what to expect when they come into the room. So that when the patient is quite an intimidating environment for patients, we're used to it, but most patients come in, they see the chair, they're already a little bit anxious. So if the dental assistant outside in reception just briefly tells the patient what to expect, it puts them at ease and calms him down. So in my room, the patient comes in, goes to the basin and have a pre-rinse. And then the dental assistant puts the patient in the chair and makes sure that she's comfortable. There you have got different ways, and I've just mentioned a few. You can use something like a cushion of headrest with good protection, infection control protection. For longer appointments, we use a blanket to make the patient warm and comfortable, and that gets used once and then washed. And then also we normally drape the patient with a bib to protect the patient's clothes, which is spelled incorrectly. I'm sorry. And then we also use eye protection. Also the dental assistant has to use her own discretion and see if the patient is that type of person that you can do with. But what a lot of my patients appreciate is when I give an injection, the dental assistant just gently rubs their arm or holds their hand. It is incredibly important for the dental assistant to be able to perform at a good level where the patient feels that you know what you're doing, that you are prepared. If you're not prepared and you run around and you open drawers and looking for materials and have to leave the room and go and find instruments at the back or go and get stuff that's not sterilized yet or still in the sterilizer, it gives them creates an environment of chaos. So it's incredibly important for the dental assistant to prepare, because normally you know what you're going to do. And in the event that for instance, emergency treatments or emergency appointments that you don't know what the dentist is going to do, listen to the dentist, listen to the words, and you can take on, quickly see which direction are we going to do, what procedure are we going to do, and calmly in the background get everything ready for that procedure. So it's important to be present at all times, be mindful, and try to always be one step ahead of the dentist. Can you add to that, Melanie?
That one step ahead. you're in tune with the dentist. And I remember after about 4 years of working with the dentist I worked with, at 12 o'clock, she used to drop the instruments. And I used to be able to catch them. By 12 o'clock, I knew exactly where to go. Those instruments, she used to get hungry and she used to lose concentration. So when I was at a party, somebody dropped a glass and I grabbed that glass in the air and they said, my goodness, you're well trained. And yes, because I knew my dentist so well, we became so close that it was almost impossible for me to leave that practice. And the fact is, one step ahead means that when you look at the procedure and you've worked together for a long time, you can read each other's minds. You literally can look at each other and have a look, and that tells a story. Every time you look at each other, you know exactly what you want. I mean, we just
Melanie,
look.
I can't encourage dental assistants more to get to that point. It will take time. It takes commitment that we said earlier, where you feel like you are like a couple that dance on a dance floor. You don't have to talk. They know exactly. It is the nicest way to work, and it's good for the dental assistant and it's good for the dentist. It is the best place to work, but it takes a lot of practicing, a lot of understanding, and reading the dentist, and with time, and just be consistently that be your goal. You will get there eventually. The next relationship that I want to discuss is the one between the dental assistant and the receptionist. Also, that's your other biggest team player in your role. So, and a person that you have to constantly communicate with. So Melanie has already touched on it, that it's important to do cross-training. So I think that every single dental assistant should have basic receptionist skills. Not only for her to stand in for the receptionist when maybe she's away for lunch or has to pop out of the practice for any reason, but also for the dental assistant to understand what the scenarios is that the receptionist find herself in. A very important thing between the dental assistant and the receptionist is that there needs to be continued daily and almost hourly communication, because you in the room sit and do clinical work. You've got a day that you have to get through with appointments. Those appointments are preset, but it can change at any time. And you can't walk out and go and see continuously what is happening with the room. So we're going to touch on that later on, where we're going to show you how important it is to put systems in place. So even with the receptionist, you have to have a system in place of how you communicate. A nice way of doing that is a huddle. So early in the morning, you and the receptionist get together and you have a look at the day and see what's happening. Sometimes there might be an appointment available for an emergency, or you as the dental assistant knows that your dentist has got a lot of admin, so you want to probably keep a half an hour open or whatever. So the two of you can communicate, you know what the day is going to happen, and you're both on the same page. You need to, in that system, make provision in this system, as you're going to see later on. I'm going to expect of you to put it down in black and white so that once again, everyone knows how the system works and they're all on the same page. So in that system, you need to determine on how you're going to handle emergency patients, cancellations, walk-in patients, how is laboratory work collected and delivered, and who is responsible, and how you're going to order implant components or any other material deliveries, and even if there's returns. Another role that you and the receptionist can fulfill in the practice and advance both of your positions and make a huge difference to the patient and to the dentist is acting as a treatment coordinator. Now, once again, here, different practices differ from each other, but if you have got a patient that needs a long treatment plan, not just a checkup, but needs a few visits and different things going to happen to that visit, it normally happens with a treatment plan that is determined by the dentist. And we say, okay, we're first going to do oral hygiene, then we're going to do a few fillings, we might do a crown or whatever. And the patient needs multiple appointments. You and the receptionist can go then and act as treatment coordinators, and with the patient schedule a range of appointments. It's also important in the dental room, and which adds a lot of value to the service that we render to the patient to have a system in place where both the receptionist and the dental assistant has a follow-up system. So, for instance, all patients that have extractions done, or maybe a painful root canal treatment or an implant that was placed, that the dental assistant will prompt the receptionist, listen, this is what we've done today, and the receptionist will then the next day follow up with a courtesy call, just to make sure that everything is fine. With the longer treatment plans, they can both be then also responsible, that I've said earlier, like executing a timeline of the treatment. A very good example, for instance, is, say, for instance, a patient has had an implant, and that patient now can only come back 3 months later once the implant is integrated. Who's going to remember to phone the patient 3 months later? You can make the appointment that's the best way, but that's a form of a system. So you can make an appointment immediately 3 months later in your book, or somehow have a system that you know that receptionist is going to call 3 months down the line and get the patient back into the appointment book. So the dental assistant is in the room. She knows what needs to happen, and she needs to liaise that with reception to keep the process going. And the last thing is a very good system on how messages, telephone messages, emails, even WhatsApp, if practices use WhatsApp, how that information gets relayed from the receptionist to the dental treatment room. And often there, the dental assistant has to play a pivotal role.
Again, coordination is the key again. So something that I think goes the extra mile is when the receptionist, and this is both ways, receptionist and dental assistant are listening to patients in the room, are taking the notes from patients, or sharing information. Patients often tell the dental receptionist or the dental assistant a lot more personal details when they're walking through. I've just had this incident happen to me. I was at my daughter's wedding, or I'm going to a wedding, I'm going to this party, I'm going to this, I've had COVID, whatever it is, they tend to communicate a lot more with the ladies. And that we need to share with each other in the practice. You cannot share anywhere else because this is confidential. That's something we really need to understand, that everything that happens in a practice is confidential. We cannot speak out on patients and what treatment they had. And especially when you get some famous people, I'm sure you have those, Janel, famous people who come in. We cannot talk about them and say, boy, oh boy, this happened and that happened, because everything that happens is confidential in that room. But what I wanted to reiterate was, not only do I like that communication between the assistant and the receptionist, I think it's critical to a good practice, because when you've had that treatment done, you phone patients, but you always hear of things happening through the dental receptionist listening to what's going on. Touch points. Has somebody died? Has this happened? It travels through to you so that you know how to treat patients. Sometimes they're just not feeling ready to have that injection or a big treatment that day. Funny enough, that can happen nowadays. They're overwhelmed with things that are happening. And that's that communication again. We share information and we touch points with patients. If we know someone has passed away, we phone them in 3 days' time and we say, how are you feeling? You know, you were in our rooms. We take the notes. We want to go the extra mile. That's how you become successful. That's how you become indispensable. That's my motto for dental assistants, how to become indispensable.
Absolutely. Okay, and like I said earlier, the dental assistant is often also the infection controlling officer, but sometimes in bigger practices, that's someone else. So the dental assistant is responsible for safeguarding the dental environment for patients as well as for all other staff members in the practice. And as we all know, in the last 18 months now already or longer, COVID has changed this part of practicing tremendously, and probably for good in the dental field. You also have to equip yourself with what is happening and what is the new ways of doing infection control, or how to improve that constantly. And it's incredibly important to stay abreast of what's, how to do that, by ways of attending webinars, going on the internet, and even SADA's website. So yes, also empower yourself. Don't wait for someone else to tell you, please go and have a look. Go, you can go out, you can go and get information, you can present it to the dentist, tell him this is how we can improve this, and see, the dentist will notice and appreciate it, because from a dentist point of view, any staff member, but more so from our dental assistant, because I work so closely with her, I love initiative. I absolutely love it when they take their own initiative. One doesn't always agree and they present it to you, but most cases I'm really like blown away and love it. So like I said as well, dentistry changes all the time. We need to stay abreast and up to date. And that not just only is required of us, but it keeps us stimulated as well, and makes our job so much easier. Then how do I as a dental assistant with my relationship with the oral hygiene, improve my position and also the service that we're rendering to the patient? So remember, the oral hygiene, the dental assistant is with the dentist in the room. So here the dental assistant can play a valuable role to coordinate treatment and communication between the dentist and the oral hygienist for the benefit of the patient, as she is present in the room all the time. The dental assistant is also ideally positioned to tell the patient within the room of all the different treatments that the oral hygienist can offer and the methods that she used. Like, for instance, what type of cleans she can have. We've got an EMS machine in the practice that's got a gentle powder that it cleans. What kind of dental tooth whitening or teeth whitening procedures is available that the oral hygienist can do. Fluoride treatments and fissure sealants for children. So when like Melanie said earlier, when the opportunity arises, the dental assistant can communicate and have a gentle talk with the dentist, with the patient, and promote the treatments of the oral hygienist. If you've got a dental shop where you sell products in the rooms, or even if you don't, the dental assistant can advise the patient on over-the-counter dental cleaning products, so toothbrushes, toothpaste, floss, and things like that, that they can buy at the shops or even at the dental room. So once again, adding value to the service and the treatment that the patient receives in the practice.
It always makes it, I would say, you're almost endorsing product, but I can tell you, when you know what you like in the range and you use the product, for instance, I love these brushes, by the way. Anyway, well, I love them and I talk about them all the time and I use them. So you can say, this works for me. This is how I'd like to work. And you can find out for yourself what's new. Speak to reps, speak to people, and ask them what are they doing in their practices when you go on courses, or if you have other friends that are assistants. You talk about what you are using. Have you had your teeth whitened yourself? Often the assistants would love to have their teeth whitened, all the receptionists. And once you've had it done, patients will also see your difference. And they will say, gee, what have you done lately? I can't tell. Is it your hair? Is it your smile? Oh, it's my teeth. I've had them whitened. You know, these are things that I can tell you after COVID. You know what happened the last section when we were totally locked down? What happened was that people who naturally went gray. They didn't color their hair during COVID. They didn't see the hairdressers. So something that happened in surgeries is that, you know, they lost their color. People came in and they looked drab. A lot of women my age, you know, in the late 50s, came in saying, gee whiz, look at what I'm looking like. And the dental assistant could play such a big role in saying, you know what, why don't we do this a little bit? Why don't we? And a lot of those patients were talking about changing their smiles. For instance, I know I went to my dentist and said, I want a new smile. Because that, looking at yourself in the mirror, looking at your hair that wasn't colored, looking at certain aspects became something that interested patients. So sometimes when a dental assistant would like to have a little change, it also makes a difference to your patients. What do you say about things? How do you present them? And also take interest all the time, take interest.
Okay, so now I hope that you've got nice tips and tools now how you can relate with the relationships in the practice and change the way that you relate to the different role players in the practice to make your position easier, to enjoy the environment that you're working in better, and to strengthen the team approach within the practice. The last slide that I want to share with you is all about organizational skills and tips and tools of how to organize your work environment better. So here, it's just a few like main ideas that I want to just discuss with you. You can fill in the details or just get the concepts and go and find out a little bit more about it in your own time. The first one that I want to discuss is the huddle at the bottom. The huddle is where the whole team gets together and they prepare each day. It should happen on a daily basis if it's needed. And once again, you will need to decide whether it's needed in the practice. And where every day is planned, it takes 5 minutes, literally 5 minutes in the morning for the whole team to get together and look at today's program and see who's coming, who needs to have laboratory work that needs to be fitted, who has got implant components that we might need, and have we got everything that we need for today in place? Who's coming for a tooth whitening procedure? Have we got the gel? And has the tray has been made, or is someone ready to make the trays when the patient comes? All those things that gets discussed on a daily basis. Not only do we do the huddle of what is happening today, but we're also looking back at yesterday and see, has something gone wrong yesterday and what it is, and how could we have done it different, and how can we avoid that it doesn't happen again? So it's a very valuable tool to help you to just improve the service that the practice is rendering to the patients all the time to a better and a higher level. Okay, so that's the huddle. The next thing that I want to discuss is the blueprint. Now, the blueprint is almost like a manual. And here again, I want to challenge all dental assistants to go tomorrow, find yourself a file, a nice thick lever, big, like a thick file that you can file in all the documents that you need for the blueprint. So the blueprint is for the dental assistant, and every other position in practice can have their own blueprint. You need to compile it yourself, and all the documents relating to your own job you will put in this blueprint file. Amongst that, your contract, your job description, all the things. And then I want you to devise your own set of documents of what you do, how you do it, why you do it, and when you do it. So it's detailed description of how I order materials, what materials are getting used in the practice. And there I'm going to jump over to the materials section of how do you do your ordering, who is the suppliers that you get your supplies from, what's their contact details, who's the contact person, how do you do your stock control, having a look at all the material, have a material file or section in that file with all the instructions of the materials that you use, how to use that, and then a lot of other little documents that you can put in this blueprint. For instance, as well, a list of daily tasks can go into this blueprint file, a list of weekly tasks, monthly tasks, your annual tasks that you need to do. I mean, list them all so that you know exactly where you, what happens when. You can put in schedules like equipment maintenance schedules. So when does equipment, the sterilizer get serviced? When do we have to have the X-ray equipment, compliance with the X-ray servicing as well? Material orders. How does that happen? Who orders it? When do we order it? Do we do it by mail? Do we do it online on the online shops? All of that things. How do we handle returns when the supplier sent the wrong materials? So how do we keep track that someone is signing for it, that they come and fetch it? Do we get a credit note back? That might not always be your job. It might be also a job for the receptionist, but all these things you need to start thinking. In that blueprint folder, you can have a section where your CPD certificates is in. So start a document like that. Also protocols. So for instance, you've learned a new technique or a new procedure that you're not familiar with, you're not so secure with, write all the steps down, put it in the blueprint file. So it's a massive file with a lot of information of exactly what you do. If tomorrow you're not there, someone else has to do your job, they can open that blueprint file and they can find exactly what you need to do. So another thing that I want to talk to you to come back to is systems. Like I spoke to you about having a system of how messages get taken, how patients get put into the appointment book. All systems, whatever system you design, needs to have the next things in common. It needs to be a simple system. It needs to be reliable, so simple that everyone can understand it, reliable that everyone knows exactly that every time this is going to happen, be consistent. A system needs to be open for change because sometimes we have to change things. We have to change the way that we do our infection control. It needs to be trusted, so we can't do it this way one day and then another day we do it a different day, or we skip a step one day and the next day we follow all the steps. And then all parties that is adhering or following this system needs to be on the same page, that it works for everyone. So if a system's not going to work, if someone says, no, but I actually can't do that. So this is all just tools. I hope it is going to help you to set up better systems in place, have protocols in place, all your schedules that you can do it, and where to have it all organized in one nice file.
So, you were saying that this is a maybe, but this is a must. So practices are getting visits from the Department of Labor. So what they're looking for is this system file. It was called a system file, but it's really a file that tells them what are all the instructions for the autoclave, for the X-ray unit, what are the rules to mixing products. If the dental assistant is not there, who is going to pick this up? So these files are imperative to have in terms of the system file and that blueprint, because if you are away for that day and you happen to have that Department of Labor visit, it means everything that you do in the practice has got to have that there. Your letters of appointment, your salary slip, for instance, rules and regulations so that your practice has. Then I wanted to say something about the Huddle. In the Huddle, what's really excellent for patients, because that's what we concentrate on a patient-centric practice. The most important person in that practice is not the dentist, not you, not the receptionist, it's the patient. So when you want to run a very patient-centric practice, you actually find in that Huddle key points. The people coming in that day, the next day, what are their birthdays? Are they the birthdays they're coming in on that date? Check their dates of birth. All those patients, check the date of birth. Make sure if you have a birthday, you do a little special something for your patient that comes in for the day. I flew to Botswana to do a course. The whole day, they were looking at my passport. The whole day, they did not notice it was my birthday. So it makes sense to do special things for patients. Are they having a wedding? Are they getting engaged? No matter what it is, you keep that little book and you make sure that you take note of special things that make people feel special. This is a time where everybody wants to be thought of as somebody that you care about. So many people are actually dying in this pandemic, but not just to mention that, but you care about people. If someone was sick, you phone them. You get the receptionist. I always work with receptionists. Of course, they have a computer. But for me, I like a daily planner, which is written. The daily planner in front of that receptionist. On a Monday, I write down this. If the person in my waiting room is saying something, I put it down in that book and I share it with my members of staff. So you need to communicate all aspects, but we've looked at ourselves and what makes us do things in a different way, but we must never forget why we do things and who we do them for and what is so important about running a good practice. Janel, I can't wait to visit your practice now. 2 years ago, I was in Cape Town and I missed it. Now I can't even fly.
You're welcome.
I got to see this place. So I'd love to see your business.
No, you're more than welcome, Melanie. So tonight, I hope we've given you a little bit of few tips and tools. I mean, we can talk about this topic for a much longer, but I want to stress to all dental assistants and tell you, don't wait for your dentist. Don't wait for the receptionist or the rest of the team. You must take the initiative. It depends on you to make your environment better, to improve your job, to improve your position in the practice, make yourself indispensable, keep on learning and be passionate every single day. It is a wonderful job, industry that we're in, and passion has to be there. If there's no passion, find something else that you are passionate about. With that, I really want to thank Melanie for co-presenting, and Dr. Shanae Maria that was so kind to do my slides for me. She did an excellent job. Thank you so much. And now, Dr. Metzing, it's over to you for the Q&A. Thank you.
Thank you very much, ladies. And I think there were very important take-home messages that you have given to the attendees this evening. And one thing that struck me is the way you conducted the presentation. It also showed the teamwork that you were speaking about. I mean, it kind of gave a person that illusion of actually being in a dental practice where the dentist is just working hand in hand with the assistant. So thank you very much, ladies. We've got a few interesting questions. There are some that I've responded to, but I'm going to give these ones to you, ladies. So the first question: do you think dental assistants should organize themselves into a trade union or join existing trade unions? Alternatively, be affiliated with the bargaining council?
Personally, I don't think so. I think, what we as dentists, and I don't even see it so much really with the oral hygienist, how we get camaraderie between dentists is that we have got study groups and platforms where we get together. It's more difficult now with COVID, but over time, and remember, this is an investment in a career for you. So you're going to start as a dental assistant and you want to stay in a practice, Melanie also touched on that, for many years. And you want to improve your skills over the many years that you're in the industry. And the way that you can do it, apart from doing it on your own, it's not a nice way to do it on your own. You want to have other people that you can grow with, and that is other dental assistants, because that's the only way that you learn, you motivate, you tell each other about the difficult times that you go through, you help each other. So that's for me more meaningful than something like a trade union. I mean, I'm not in a political, I don't know what other benefits that can give, but to strengthen your camaraderie and feel that you're part of a group, I would say that kind of platform is much more valuable. And you can once again take the initiative.
So, there's an existing organization for dental assistants. That is the Dental Assistants Association of South Africa. Joyce Rapidi is the president of that organization. And just as dentists have a dental association, they actually pay an amount of money to the dental association to keep matters going. Like to have seminars like this, they cost money. Mm-hmm. The Dental Assistants Association has been running for many, many years. It is the poorest of the poor. We have tried, and I speak from the association, from the heart of the association. We don't get payments from members, and that, I believe, is the way to go, is to have a very strong association where we can share conferences, we can rub shoulders with dentists and fellow team members, and we can actually communicate far better. And I think, the communication with assistants and dentists is really important. And I think we didn't want to touch on money, but, and I'm sure this bargaining council is related to salaries, etc., from my experience, but become indispensable. That is my trick. That is the rule. Use this incredible gift that you all have. Become indispensable to your dentist, that he cannot work without you. And then you start to say, but doctor, I can do the following things. It's not, I want to go home early every day or any of those things. We need to be part of a team. What I always stress as well is that dental assistants can never leave a dentist alone. You cannot go home before the dentist. There are too many risks. There are risks of you being sued. There's so many things that can go wrong that are not wrong, but are perceived incorrectly. So the assistants must realize we fought hard and we fought long. In 1983, we started, the Assistants Association was going before I joined in 83. So you can imagine, we fought very hard, we fought very long to become part of the dental team by getting this registration with the Health Professions Council. You're part of a team, you are a professional. So behave in a manner that is a professional way. And that is to educate yourself and to make yourself indispensable. And then I was saying to Dr. Welgemoed, the woman is the neck, and you move the head, and the man is the head. And what you can do, it's a bit more difficult when the woman is the head and whatever. So you can imagine. But what I'm saying is you can always help people to make decisions because the neck can move the head. The head makes the decision, but the neck is putting it in the right position.
Thank you very much, Melanie. Thank you, ladies. The next question, is there a document that details the job description for dental assistants?
Yes. May I answer that? The role of the dental assistant is described quite well. If you just look at, for instance, you'll go to the role of a oral hygienist or the dentist or an assistant with the Health Professions Council. You will go onto the website and there will be a clear role description there.
But I think also it's important there, remember the job description is not a contract. That the dental assistant compiles that herself with the dentist. So start with yourself. You write down everything that you do. A good way to start is what you do daily, what you do weekly and monthly, and then take it to your dentist, and then the team can elaborate on it. But there are multiple examples of a job description on the internet as well. You can just Google it. I can help anyone if they want to. They can mail me if they need any help. Right.
Thanks, Dr. Welgemoed. And then we've got another very interesting question. It's filled with comments and a question there. Very difficult to feel like a hero as there is so little CPD opportunities for dental assistants, especially the current webinars or the current webinar excluded. We have to attend lectures designed for dentists and or oral hygienists, not to mention the lack of representation for dental assistants. How many dental assistants know of and belong to the Dental Assistants Association that Melanie has just spoken about? So I don't know if you ladies would like to interrogate that statement as questions and statements that are being made in that.
I think Melanie is probably better positioned to answer that, but I want to stress again from my own point of view and as a dentist with the Dental Association, the Dental Association is fantastic. I've belonged to it from the beginning of my career, but I think the value is more in a smaller platform, like study groups and things like that, and there you can present, different people can present. There needs to be, it can be under the umbrella of the Dental Assistant Association, but it needs to be on a smaller provincial or regional chapters as well. And then you will get that, like that friendships and get to know the dental assistant 2 practices away or in the town next to you. And that's a much friendlier environment to get to know people and to learn in a smaller group. Dentists do this all the time in all these different study groups that we've got in platforms.
So the Dental Assistants Association have got a number of groups in each province that would meet. But to be honest with you, it is almost run dry because there's no payment. And I'm sorry to say that perhaps the members are younger now, and so they haven't come into a team where it's been prominent. But over the years, it's been pretty well recognized, and there were a couple of conferences a year in different areas. And I do see that, for instance, if you were living in Kuruman or you were living in Nelspruit or Polokwane, it's very difficult to attend conferences and to get CPD points. Okay, so there are companies, and I'm not advertising for Henry Schein or any particular company, but they do offer online CPD courses. And one of them is offering a course which will be every single month you can earn 2 CPD points. If you do an online learning program, and it's not just about dentists, the program is about dental materials. And so you can earn 2 points a month, and you actually need 15 points a year. I'm not quite sure how the Health Professions Council is handling those CPD points. Doctor, if you could perhaps tell me, do you have any clue if have they made any special arrangements with CPD points for the year, with dentists earning 30, dental assistants 15?
No, there's no special arrangements. The requirement is still the same, Melanie. Even during this pandemic, the requirement is still the same. And hence, we have hence we have also made sure that we have as many webinars as possible. And I was just about to add that even though the member might feel that a lot of the webinars are designed for dentists, I've sat in the webinars, and even an assistant can benefit from those webinars that we've had. I mean, like you have said, if it's a webinar where they're talking about clinical, I mean, a dentist, like you ladies have said, cannot work without an assistant. So whatever the dentist needs to know when it comes to the treatment, the assistant also needs to know it. I mean, sometimes you need to also, it's nice to have that assistant that is a step ahead of you. When you're doing a procedure, they give you the instrument before you even ask for it. And maybe it's because they've gained that knowledge from the webinars that they would have attended. So, I mean, I would advise the member to try these webinars that we are having, even though she may feel like they are more for dentists. She must just try attending them and see if she does not really benefit. She will still get the point for being there.
I agree with Dr. Mitsing. If it's a webinar relating to clinical work or clinical dentistry, it is equally relevant to the dentist and the dental assistant. Like I said in our presentation, we do that work together. The dentist is just the one that has the handpiece in the hand, and the assistant is doing the auxiliary work. But we're doing that procedure together. So it's imperative that the dental assistant, and that's exactly what I meant with tonight's webinar, is that the dental assistant must take charge of her position. Go out and empower yourself. Be the dentist with the dentist in the team. You're one team.
That's very true. And you can learn so much from these webinars, but also to punt our conference, you know, the conference coming up in August. The dental assistants have got a program running. We're going to be having some other speakers on, but particularly with, for instance, in periodontal surgery, we've got a speaker coming on. And so that program we want to fill a little bit more than what we have, but the girls can get onto that system with their cell phones. And, you know, you're not left out at all. So please take note, look at the programs, ask your dentist that you're working for, have they got the program? Otherwise, you can contact SADA directly, and they have got a program already set out where you can see where the dental assistants are taking part and what you can do to be on that program.
Absolutely. Absolutely. Thank you, ladies. And Dr. Welgemoed, there's an attendee who would like to get a hold of your intellectual material. So they're asking if it's possible for them to get this presentation.
Yeah, sure. She can mail me. I don't know if, or just, shall I give my email address now?
We will facilitate.
Okay. Yeah,
we will facilitate. I can ask the member just to
email address.
Oh, it's also on YouTube.
It's
Yes.
on YouTube.
It's on YouTube as well.
Yeah,
but
I'm
just
on
welcome to
YouTube.
contact me. Yeah, thanks.
Yeah, and we will facilitate. Kulani Mabunda, please can you just email info@sada, or you can even send it to profdev@sada.co.za, and then we will make that presentation available. But like Melanie has said, It's available on YouTube, and it will constantly be available on YouTube. Okay, the next question. What should the receptionist and the dental assistant do if a patient refuses to sign the POPIA Act addendum on the patient form? A very rude patient this morning insisted on being seen by the dentist, but refused to endorse the requirement of the POPIA Act.
Yeah, I would make a note of it in the patient's file and inform the dentist, and the dentist will have to handle it further.
Yeah, thank you, Doc. The next question. Yeah. Thank you, Doc. Why does the dental assistant still get paid? I think, Melanie, here's the question that you alluded to. Why does the dental assistant still get paid the least of money in most of the practices if they need to do all these tasks and know what is going on in the practice and have all this knowledge?
Shall I answer that, or? I think that it speaks for itself, okay? When I started as a dental assistant, I knew absolutely nothing. And I was very lucky to work with a lot of excellent dentists, and I was interested. So I was really interested in the practice of dentistry. I enrolled to become a dentist at one point in my life because I was so interested and I enjoyed it so much. You need to have passion for what you do. Number one, it's not only about the dentist must show you things. You need to show that you're interested. Teach me. So I really feel there's a lot to be said about making yourself available to be taught and not expecting from the beginning to earn high salaries, but grow yourself. Grow yourself. And I've said to you, if you are fantastic, there's no dentist I know that's going to say, okay, you can leave me. I hope that helps you.
I also feel, and I've got sympathy with a lot of dental assistants that probably feel that they are not earning what they should be. But there is no other way to change that situation unless the best chance of changing that situation is becoming passionate about what you do and be consistent about it. Believe me when I tell you, no dentist that loves working with their assistant on a daily basis and really appreciate what that assistant does is not going to eventually. It starts off by compliments with like really appreciation, and then next comes the money. But the money is not going to come overnight because if you're not valued and you don't feel valued, then you so easily go into a downward spiral. I'm not going to put any effort into this job. I'm not going to be friendly. But if you change the tide, that's your best chance of changing the tide for better salary. But it takes consistency, it takes patience, it takes commitment. And I promise you, just give it 6 months and you will see the difference. But you have to have that goal. And the last thing I want to say about it, passion doesn't always get remunerated in money. It is important, and I do feel that we need to pay our staff well. I really do feel that. But passion doesn't, no one has passion just to earn more money. You've got passion because you really love what you do. That's the beginning point.
Beautiful. Thank you, Doc. And Melanie, here's another question for you. Are dental assistants supposed to be wearing epaulets, which DASA has for assistants?
You don't necessarily have to wear epaulets, but when you want to be part of a team and you want to be recognized, one of the things is, the dentist will have some certificates on the wall, and patients will look at those certificates on the wall and say, gee, my dentist is well qualified. And I urge dental assistants, once they've done workshops and courses, to have their certificates visible in a practice as well. Be part of a team, and if you'd like the epaulets, you can wear them. You don't have to. Excuse me. You could also wear a name badge which says which part of the practice you represent, that you're the assistant in the practice or the receptionist. It is important to say who you are.
Thank you very much. I think one of the questions that one of the questions that keeps popping up is the online course for dental assistants. It's the online course, and whether and another question that is coming up as well is whether assistants that are not registered with the HPCSA, are they allowed to be working? I think I'm going to allow the panelists to answer this question, but then I'll also have an input on that one. So I'm going to hand over
to work.
Yes, if they are not registered with the HPCSA.
No, they're not. Unfortunately, that is the dilemma in private practice. Unfortunately, but the law says no.
Yeah. Melanie, before I come in.
The law doesn't stipulate that you can. You have to be qualified, and it is becoming a serious situation. And now the situation is the only way to become a qualified assistant is to attend a university such as TUT or Bloemfontein or Natal or Cape Town. Technicon's there. That's the only way that you can qualify currently.
And unfortunately, what the two panelists have raised has been a problem that SADA has identified, and that is why we took the initiative to register an online dental assisting course. Unfortunately, in the country, we do have legislature, we do have processes that we need to follow. It cannot be an online, an overnight thing that happens. But I can assure members that we are in the process of registering that course with the Council for Higher Education. They have their processes, they have their own red tapes, so we are still following that process. It is taking time, but I just want to assure members out there and the dental assistants that are working out there without qualifications that we are working on getting an online course, because I think that's one of the solutions, because I mean, all these institutions that Melanie has mentioned are in the affluent areas, and you might find that in those areas, a lot of practitioners are not struggling as much to get dental assistants that are qualified. It is our Limpopo, our Mpumalanga, our far-flung provinces that are really struggling. But I just want to reassure members that we are working on that. It is a process that is not entirely in our hands, but we started nonetheless. And yes, like Melanie and Dr. Welgemoed have said, you may not work unregistered with the HPCSA, unfortunately. And sorry, Melanie.
I should mute myself.
All right. And we've also written to the HPCSA that have also sent a request to Parliament. Like I said, all these things do not just happen in one office just because you've made a request. It goes through different processes. So in the near future, we are hoping that the grandfather clause will be opened again and allow those trained practitioners or assistants who have sufficient experience. Perhaps they would be subjected to the board exam that will be written with the HPCSA and get that opportunity to register with the HPCSA. But like I said, these are all processes that we unfortunately have to follow, and there's no way of bypassing them, however pressed we may be. So I think we've got a lot of other messages that are coming through where people are thanking you for the beautiful presentation, and I also reiterate that. We've got one question as well that is asking, do assistants, and I think this one is posed to me, do assistants also register on SADA with their DSA number and get their CPD points on the SADA site? Yes. SADA has a membership category for dental assistants, but for now, with the webinars that we are running, you do not even have to be a SADA member. You just attend, create a profile on our website, and then you are able to get your CPD points. And that is why we are encouraging. And I've just checked online as well. For the Congress, dental assistants who are SADA members only pay 150 rands, and those that are not SADA members pay 175 rands. So I mean, you can attend the Congress and get your points. You really do not have, I mean, we've had a couple of assistants that have contacted SADA and said that they do not have the sufficient number of points that are required by the HPCSA. Really, you don't have to suffer like that, because there's many platforms where you can actually attain your CPD points and actually be compliant with the HPCSA. So another question. My philosophy is hire for attitude and train for skills. I recently opened a practice, and my main challenge is dealing with negative attitudes and also managing limited experience in the workplace. My leadership style is a mixture of democratic and coaching type. I suppose this is a practitioner. And reprimanding my assistants becomes a challenge. Please help on how I can discipline them without hurting their feelings.
Okay. For me, that is a very, very good question and a very good everyday scenario. So the best way of handling that, or how I find it, is once again, good communication, and it's a relationship. So like any other relationship, sometimes it's actually expected of everyone to give 100%. But sometimes you, as the dentist, have to give 150%. If the other person's attitude is not right, there will be a time that you will not have the right attitude and that person gives it out. So that's the way the relationship works. And you have to do it continuously and believe in it. And as far as reprimanding is concerned, I'm not so keen. You know, I do speak my voice if I'm not happy. So you have to tell when you're not happy, because we have to give a very good service to the patient, and it can be dangerous if we don't know how to do our job well, is to consistently take the assistant back to what you expect her to do. But then also, the best tool in the room is appreciation or acknowledgement of when you do something right. So acknowledge the things that they do right. Say thank you for the things that they do. And then it's so much easier to show them in a very diplomatic way. I would like you to change the way that you do this. I'm not happy with how this happens now. Do you understand how to do it? Can I help you to do it differently? You know, that kind of way. But just appreciating and saying thank you, and I like the way you do this, builds their self-esteem, and then it's easier to tell them if you want to change things that they're not doing 100% correct. But it takes time, and eventually you will bear the fruit of it, both parties.
Thank you, Melanie. I don't know if you want to add something onto that. I think we've addressed.
I'd love to. I'd love to. I'd love to say that if you look at how many people actually leave their workplace, and you would imagine that 95% of people leave because they weren't happy with their salaries, and it's not true. Way down the list of the reason why people leave is your salary. Top of list is you don't recognize the person. You don't acknowledge them. And so what Dr. Welgemoed was saying is absolutely true. You cannot, beat the child with a stick. You need to encourage children and your people that work for you almost in the same way, I must say, where you acknowledge their good points more than the bad. So give them confidence, give them skills, and you will find that you will build a person who will be a person who will stay with you longer. But if you are a person that at the end of each day you list all the things they did wrong, it's never going to work.
You have to invest in that relationship. You have to invest in the relationship to eventually be a team. And I tell you, there's not a day that goes by that I don't thank, and I mean it from the bottom of my heart, to thank my assistant for things that she does. When she makes me tea, I sometimes buy her lunch. We care for each other. It is that first slide that I showed. Really take that to heart and start somewhere small. It grows from there. You soon see the fruit of your labor, and it grows. You will be amazed what you can do in a few months' time. The assistant that I work with now, when she had to start working for me, she said, oh, she'll never work with me, and I never wanted to work with her. And she is, I appreciate her every day. She's 64 years old and she can't retire. Anyway.
I think, ladies, we've addressed a lot of the questions that we had, and I've seen that the biggest concern that members have out there is this dental assisting course. And I would just like, as my parting shot, I'm going to hand over to the team just to give their final remarks before we close the session. It's just to reassure everyone that we are doing something about it. Unfortunately, some of these things take time. We just need to be patient, and we do understand that there are problems that do arise during that time, that waiting time, but we are working on resolving that particular problem. With that, I'm going to hand over to Dr. Welgemoed just to give her last remarks, and then Melanie, and then we end the session.
No, Dr. Maxine, thank you for the opportunity. And I really wish all dental assistants the best. Be passionate, take charge, and take initiative, and stay positive. Thank you very much.
Thank you. Melanie?
Thank you. Thank you so much for the invitation. And thank you, Janel, for putting me on the team for this talk. I appreciate it, and we got on well. You see, an ex-assistant and a dentist can really work well together and acknowledge what we have to share.
There we are.
And so that's what we want. And it's possible. I was an assistant for 4 years before I went into other fields, and I loved the position. You are all capable of so much more, but you need to communicate and need to take charge of your life. Thank you.
Thank you very much, Melanie. And with that, I want to encourage everybody to register for this Congress. It's going to be a very exciting one. We've got a whole lot of international speakers, so the standard is on another level. So I'm encouraging each and every one of you to please register. The dental assistants, we don't want to hear in the next webinar that you're not reaching your points. Please register for this Congress. You have an opportunity to get 17 points at that Congress. Please do register for the Congress for all three. And as I've said, for the dental assistants, it's 150 rands if you're a SADA member, 175 rands if you're not a SADA member. That is not a lot of money. So please, please, please register for this Congress, and we'll see you at the next event. Thank you very much, ladies, and good evening.
Thank you.
Thank you. Thanks.
Thank you.
Thank you.